While Pfizer and BioNTech submitted data this week to the Food and Drug Administration on the safety and efficacy of their COVID-19 vaccine in younger children, kids may not be able to get the shots until November, reports say. The Wall Street Journal, citing an unnamed source, said the companies would submit their application for emergency use authorization in the coming weeks even though they had targeted the end of September. Reuters also reported the companies had not started the official process. That may mean authorization could be delayed until November, the journal reported. Reuters reported it could come as early as the end of October. The companies Tuesday submitted their clinical trial data to the FDA, which showed their vaccine is safe and effective in children ages 5 to 11 at one-third the dose used in adolescents and adults. Once the emergency use authorization application is submitted, regulators with the FDA and CDC will review the data and consult independent advisory committees in the same process that occurred with the authorization of vaccines for adults and older children. San Diego Unified School District, the second largest district in California, will deploy compulsory vaccines to all employees and students aged 16 and older after the vote of the board on Tuesday. All will be required full vaccination before December 20. The World Health Organization shows that COVID-19's cases and deaths worldwide have decreased by about 10% in the past week, continuing to decrease. Contact continued for many weeks. Compared to the week ended on August 26, the week ended in Monday with less than 30% of cases and less than 21.2% of deaths, a USA Today's analysis showed. The United States has reported more than 50,000 COVID-19 deaths in September. Through Tuesday, with 2 days of counting remaining in the month, the country has reported 51,789 deaths, a USA Today analysis of Johns Hopkins University data shows. New York's COVID-19 vaccine mandate for medical workers prodded about 55,600 people into getting shots over the past week, raising the partial vaccination rate at hospitals and nursing homes to 92%, according to statistics released by Governor Kathy Hochul. About 35,600 workers were still poised to leave jobs at hospitals, nursing homes and adult care facilities to avoid getting vaccinated. Tar, North Carolina-based hospital system said this week that more than 175 of its workers have been fired for failing to comply with its COVID-19 vaccination requirement. New polling found older Americans who are vaccinated were far more worried about COVID and taking extra precautions compared to unvaccinated older Americans. The Associated Press NORC Center for Public Affairs research poll also found older adults worried about the virus were more likely to say they've felt social isolation or a lack of companionship in the past month. Los Angeles might implement new vaccine mandates for indoor public locations including gyms and restaurants, the Los Angeles Times reported. The city council will consider the plan on Wednesday. Families at an Iowa school district who are angry over a new mask mandate are threatening to unenroll their students ahead of the school's student count date to artificially lower enrollment numbers, potentially costing hundreds of thousands of dollars in funding. California's Department of Public Health issued an order Tuesday requiring all workers in adult care facilities and in home care workers to be fully vaccinated by November 30. The U.S. has recorded more than 43.3 million confirmed COVID-19 cases and more than 694,000 deaths, according to Johns Hopkins University data. Global totals, more than 233 million cases and 4.7 million deaths. More than 185 million Americans, 55.8% of the population, are fully vaccinated, according to the CDC. Alaska sees soaring COVID case counts since summer. COVID-19 cases in Alaska have soared since the end of July, state data shows. On July 31, the 7-day average of new daily cases was under 230. On Monday, it reached 1,250. While the data this week includes Friday, in which 1,700 cases were reported, including some backlogged cases state health officials were only just now reporting, the surge has strained hospitals in the state. The state epidemiologist said Alaska was in the biggest surge it had experienced during the pandemic, and a weekly report from the department last week said the state had more people hospitalized with COVID-19 than it did at the peak of a prior surge late last year. While pro basketball players are not mandated to receive a COVID-19 vaccine, unlike coaches, trainers and referees in the NBA, the league on Tuesday sent to teams its 61-page health and safety protocols for the upcoming season, which make clear it wants players vaccinated and plans to institute greater restrictions for unvaccinated players. Unvaccinated players will be subject regular testing, they won't be allowed to eat indoors in the same room as their vaccinated teammates, and their lockers will be as distant from other players as possible and not next to another non-fully vaccinated player. Over 90% of players are vaccinated, said Players Union Executive Director Michelle Roberts, but NBA spokesman Mike Bass said the union rejected any vaccination mandate. YouTube said Wednesday that it had crafted new guidelines to crack down on medical misinformation about vaccines being shared in videos on its platform. The company said the new rules were intended to cover misinformation about vaccines in general, not just COVID-19 vaccines. The platform said it had seen false claims about COVID-19 vaccines lead to misinformation about other approved vaccines in recent months. Specifically, content that falsely alleges that approved vaccines are dangerous and cause chronic health effects. Claims that vaccines do not reduce transmission or contraction of disease or contains misinformation on the substances contained in vaccines will be removed, the company said in a blog post. The false claims that vaccines are tied to autism or infertility or that vaccines contain some sort of tracking material are also included in this crackdown, the company said. Pregnant people have low vaccine rates despite severe risk of COVID. Vaccination rates among people who are pregnant have been low, despite evidence that vaccines can prevent the severe risk of severe disease posed to pregnant people from COVID-19. Only 18% of pregnant people have received a dose, according to the Centers for Disease Control and Prevention data. Women giving birth while having COVID-19 had significantly higher rates of ICU admission, intubation, ventilation and death, according to a study published in the Journal of the American Medical Association. In August alone, 21 pregnant people died of COVID-19, according to the CDC. Scientists have said vaccines are safe to be taken at any time while pregnant or breastfeeding for both mother and baby. COVID quarantine. Some colleges say students are on their own after positive tests even among college campuses. The divide across America around how to address the COVID-19 pandemic is widening. A growing number of U.S. universities are trying to return to normal operations, eschewing quarantine spaces, COVID-19 tests, flexible online classes and remote work for staffers, even as the coronavirus remains an active presence on campuses. Other universities are taking aggressive stances to reduce case counts on campus, including daily testing requirements for unvaccinated students. Some institutions, such as the University of Wisconsin, are still providing housing for those who need to quarantine or isolate. Others, such as the University of Delaware, have some space for students to isolate but encourage students with positive cases to return home if possible. It's still too early to know whether one approach is wrong as the Delta variant surges and cooler temperatures are on the way, said Jerry Taylor, a co-chair of the American College Health Association's COVID-19 task force. Follow official guidance amid booster craze. Experts say COVID-19 boosters are now available to millions of Americans who fall into certain broad categories and want greater protection from the coronavirus. While many are relieved boosters are finally here, there's little policing to ensure third shots go to the intended people. Health experts say some people who don't meet the requirements are ignoring official guidelines and seeking third shots. Right now, it's been the Wild West. I know people are going out and helping themselves to all kinds of things and basically lying to do so, said Dr. Camille Cotton, an infectious disease expert at Massachusetts General Hospital and a member of the Advisory Committee on Immunization Practices, a CDC advisory group. Following CDC guidance, hospitals and pharmacies are relying on patients to self-attest their eligibility as defined by the guidelines to help reduce barriers to access for these select populations. While it may improve access to vaccines, it also leaves room for people to be dishonest. Michigan's new definition of a school outbreak will mean fewer are reported. The Michigan State Health Department is increasing the threshold for the number of COVID-19 cases that would constitute an outbreak at a K-12 school. The move will result in fewer reported outbreaks and inconsistent state data, coming at a time when school outbreaks are on the rise and local health leaders are pleading for a statewide mask mandate. As of Monday, an outbreak at a school must have 3 or more associated cases. For the past 18 months, an outbreak consisted of 2 or more cases. The new definition will not be applied to older outbreaks. If this change had been implemented at the start of September when many students returned to classrooms, the state could have excluded almost 25% of new school outbreaks reported in that time frame.